Dear students, in the last class, we have seen the different types of uh, health insurances, and mainly we have categorized into three headings, that is social health insurances. Then we have seen the private health insurances and public health insurances. Now we were discussing the social health insurances. So various types of the social health insurances, in that we have studied that there are different schemes, and one scheme we have seen in the last class, that is the ESI, Employee State Insurance Scheme. So I'm not going to repeat anything what I have spoken in the last class. So regarding ESI, I have explained very well. Now another social insurance health insurance scheme is Central Government Health Scheme, CGHS. This is called Central Government Health Scheme. So the CGHS provide comprehensive health care facilities for the central government employees and pensioners and their dependents residing in the CGS covered cities. So what it says is it's mainly to the employees and pensioners whoever were the earlier employees. So for the it's a project for the government employees. Last time we have seen that ESI, and ESI is not to the government employees, but it is to the private employees whoever working in the unorganized sector or organized sector of the private parties, but these are to the government employees, started in New Delhi in 1954. So it's much old and operational in 25 cities in India. It is not restricted to all, it is not fixed to everybody. So this is only for the particular cities. So CGS covered cities are there. In such cities only this facility is available. Let's move to the next slide. So CGS, Central Government Health Scheme, who are all beneficiaries, who all come under this. As I've said, one in general government employees, this one what you call and pensioners. But in that also there are restrictions. All central government servants will be there. Pensioners and their family members. See, even the family members of few, means whoever are included, there is a restrictions in that, so not all the family members. Then honorable members of a parliament, then we have honorable judges of Supreme Court of India, then employees and pensioners of autonomous bodies covered under CGHS, then former judges of honorable Supreme Court of India and honorable high courts, then freedom fighters. See, we see all these people are included in the central government health scheme. So what are the services that we can avail from the central government health schemes? Emergency treatment is available, outdoor services available, indoor services available, domiciliary visits, then specialist consultation is available, uh, antenatal, natal and postnatal services, then family welfare services, then supplies optical and dental aids at a reasonable rates, not complete exemption, some for the optical eye and for repairing your tooth, so some expenses has to be borne. Then laboratory and x-ray investigation, then pediatric services including immunization, all these services could be availed in this scheme. So next, monthly contribution towards the CGHS. As I have seen in the earlier ESI scheme, that there is a monthly contribution from the employer side as well as the employee side. In a similar way, in the under the CGS also there is a monthly contribution towards the CGHS. So what is the contribution has to be given? The employees who are getting, it's fixed in the 2009. After that later I don't know. Those who have the monthly contribution, monthly payment up to 1650, they have to pay per month. Below 1650 salaried people were supposed to pay 50 rupees. 1800, 1900, 2000, 2400 and 2800, means 1800 to 2800 people are supposed to pay the rupees 125. Then 4200 people were supposed to pay the rupees 225. 4600 to 6600 we are supposed to pay 325 rupees. Then rupees 7600 and above we are supposed to pay per month 500 rupees as their contribution to this fund. What are the main components in the CGHS, Central Government Health Scheme? So the dispensary services, then family welfare and MCH services, specialist consultation facilities, hospitalization, provision for medicines. These are already we have seen the facilities that contain. Then what is the network we have in India today? So 254 allopathic dispensaries are there where they can get the benefits of CGHS. Then we have 19 polyclinics, then 78 Ayush dispensaries or units, then 3 yoga centers, 65 laboratories and 17 dental units. Within these only you can get the benefits of CGHS. If you go, so these much units are there available for getting the benefits of CGS. Then problems in CGS, slow reimbursement, not immediately you will get the payment, slow reimbursement. Then demand side moral hazard, there is see many patients are self-referred. It appears that most patients prefer to bypass the dispensaries and directly avail of specialist services. See the dispensaries which we have just saw in the previous slide, in that place only a person has to patient has to visit, but many people bypass the dispensaries and directly go for the special service. This is a problem. Then poor quality care, government hospitals sometimes they don't take care, so some may take care very well, so we can't say which and what. So the treatment in the private hospitals sometimes getting better, so long waiting periods, inadequate supply of medicines and equipments. Private hospitals to stop CGHS cashless scheme from March 7 to 2015. The Times of India CGS owes these hospitals around 200 crore in unpaid services and unreasonably low CGS tariffs. So there are many things regarding this problems and all. So we'll not be discussing much regarding the problems. Let's move with some more things. Universal health scheme, another scheme of another social health insurance scheme. So launched with effect from 14/7/2003 for BPL families, below poverty level families. This was framed. So standard product with an annual cover of rupees 30,000 for a family. So it's not a big amount that you are getting, but because it is only for the below poverty level families. So premium of rupees 165 per year per person. So rupees 248 for a family of 5 and rupees 330 for a family of 7, according to the number of person or persons in the family they have to pay per premium in a year. So this premium is nothing, this is very low. 165 means per day it comes just a 50 paisa. So and then 248 for a family of 5, you just imagine. So per person it is just 50 rupees you are paying. Then 330 for a family of 7. Here also you may be paying around 50 rupees per head, not more than that. So universal health insurance scheme reasons for failure. So it is a failure because the public sector companies found it to be potentially loss making, improper identification system of beneficiaries, cumbersome paperwork. So what is mean this one cause for failure is improper identification. So properly not identified, even finding out the BPL or the needy people is a very difficult case. Even though there are some rich people, they will come say that we are living under below poverty and all. So identifying the people have become a greater problem. Now we have another scheme that is also made for the BPL. So Rashtriya Swasthya Bima Yojana. In short, it is called as RSBY. So this was started in the year 2008, 1st April. So launched by Ministry of Labour and Employment, Government of India, to provide health insurance coverage for below poverty line BPL families. This is also, we must remember that for the BPL families, launched by the Ministry of Labour and Employment, one of the ministry of the central government. Then beneficiaries under RSBY are entitled to hospitalization coverage up to 30,000. So this is also not a much big help will be given, a small amount for most of the diseases that require hospitalization. So usually payment is made for the diseases that are requiring hospitalization. So RSBY is supposed to become operational from 2008 2009 and all 600 districts of the country to be covered by 2012. It is the target is to cover everybody and every district. So objective to provide health security for the below poverty line workers in the unorganized sector and their families through an insurance that cover for hospital expenses provider. So public and private sector is both, not only to the public sectors, it is public and private sector both. So next, pre-existing conditions are covered from day one and there is no age limit. This is also we must this one, even the pre-existing in some health schemes, if the sickness is existing earlier, that is not considered and that is not covered, and age limit is also not there. There are a few insurance policies, they have a age limit. After that they don't provide, because after 60 70 it is understood that people will be having a sicknesses now and then, and they have to pay heavy expenses. So coverage extends to 5 members of the family, which includes the head of household, spouse, and up to 3 dependents. So they have made it clear who all could be the members, and maximum limit is a 5 member family. If it is more than that, they will not cover it, they will cover it only 5 people. Beneficiaries need to pay only 30 rupees as a registration fee. You be clear, only 30 rupees. It's a complete free of cost to the BPL families. RSBY facility. Central 75% and state 25% government, central government and state government share that. Pays the premium to the insurer selected by the state government on the basis of a competitive bidding. So your premium is, you are paying only 30 rupees, not as a premium but a registration fee, and your premium 75% is paid by the central government and 25% is paid by the state government. So what are the unique features of RSBY? Empowering the beneficiary, business model for all stakeholders, information technology, intensive, then safe and foolproof, portability, cashless and paperless transaction, biometric enabled smart card. These all are the salient features of the RSBY scheme. So what is this RSBY plus? It is a something new. It's an addition to the RSBY introduced in the 1st of March 2010 in Himachal Pradesh. In additional benefit of rupees 1,75,000 is provided under critical care for meeting the expenses of surgical procedures from 1st January 2013, extended to other categories, that is APL, Manrega, building and other construction workers, person with more than 70% disability, domestic workers and street vendors. Manrega, Mahatma Gandhi National Rural Employment Guarantee Act, APL, above poverty line people are covered in this. So here I will be closing the class today, and in the next class we will be seeing the private health insurances and different companies providing the private health insurances, and different companies of the private health insurances will be seeing. Then community based health insurances will be seeing later. Thank you.